We do get a lot of hesitation with the TCC because you can't bathe in it, especially right now it's summer, so people think that it's hot. If it's on the right foot, they can't drive, so there is some inconveniences to it. I think when someone is really reluctant to try the TCC, I remind them how much experience I have working at the wound care center and how many patients we see every single week, and how people who have wounds, particularly on the bottom of their foot, it is very, very difficult to heal. And so when we're educating our patients about healing a wound, we're looking at things that we can eliminate. So we make sure that there's not infection, we get rid of bacteria, right? And we try to make sure the environment is good for the wound. And another big thing, if it's on the bottom of the foot, is we want to eliminate pressure so that the wound can have a chance to heal. So if somebody is really on the fence about putting on a TCC, that's what I focus on. And then we educate them every time they come in. Hey, what you're doing is not working. Oh, I think I'm going to try a rollator, or I'm going to have like a little scooter that I'm going to try, or I'm going to try this other boot that's supposed to be offloading. And we're usually able to tell them every week, hey, your wound is stalled, or your wound is really making slow progress. If you would give the TCC a try, let's go ahead and give it a try and see if it improves. And I just go back to how many patients we've seen that have healed by using the TCC and how much quicker it is when you eliminate that pressure.
Sure. Everybody is concerned about driving. Are they going to be able to drive? And they're concerned about showering. And I tell people, if we're having to put the cast on their right foot, they really shouldn't be driving. It's not safe. They don't have that ability to move their ankle, and it's this big bulky thing on their right foot. So they shouldn't be driving. They may have to get a family member or a friend to help them, or assist with transportation. People are concerned about showering. That is a valid concern. They should not be showering with the cast on. Some people have tried, special bags and special garments that they wear to try to keep the cast dry, but if the cast gets wet, it has to come off immediately because, there are potential complications if you have a wet cast sitting on your foot. So those are really the biggest things. And I tell people, no, you kind of need a sponge bath, wash your hair in the sink, that kind of thing. And then, they're just concerned, can I go to church with this? Can I walk around the grocery store? And, I tell them the point of the cast really is to protect your foot while you're walking. It's also supposed to be somewhat uncomfortable so you're not walking as much. So we don't want you out walking around the mall and walking your dog 5 miles. We want you walking from the kitchen to the bathroom, that kind of thing. And that's part of the treatment to get the ulcer better.